The most recent key findings are that alcohol is a leading preventable factor for multiple different cancers. It's estimated that it is the third leading cause of preventable cancers behind smoking and obesity.
Semprini says a statistic cited in the report indicates that 72% of Americans reported drinking one or more alcoholic drinks each week.
So almost 3 out of 4 Americans drink on a regular basis or report drinking on a regular basis. So it's very common. Second point is that even though alcohol drinking is common, the knowledge that there's a risk association between alcohol and cancer is not well known.
Interestingly, as we think about this, we can think about it as we drink alcohol, it seems to affect those tissues maybe that it touches more. So mouth cancer, throat cancer, the voice box, which it doesn't really touch, it doesn't pass through the voice box, but it's one of them. The esophagus, the liver, which again, it doesn't touch, but it is really metabolized by liver largely, the colon and rectum, and then for women, the breast. Those would be the 7 kind of main cancers that they have found a clear association with increased risk.
Both stated men and women are susceptible, but women have an increased risk.
I mean, obviously, consuming less would be one, but then monitoring your other risk factors. Try not to smoke. Monitor your weight. Obesity is another risk factor. So that would be one thing. Making sure that you're eating well. So eating a diet that's maybe more anti-inflammatory, if you will, which typically involves vegetables and fruit, and limiting sugar, limiting processed foods, or processed meat especially is a big one.
I think, again, showing that there's an association between drinking alcohol and cancer risk, I think that's going to be probably informing future education programs. It's probably already happening as a result of this program. What I also expect, though, is maybe a little bit more quantifiable evidence showing the change in risk for specific subgroups of populations, focusing on harm reduction in specific groups who maybe have a higher burden of harm from alcohol, not just cancer, but alcohol abuse, driving under the influence.